October is Breast Cancer Awareness Month, and according to the CDC, each year in the United States, about 240,000 cases of breast cancer are diagnosed in women and about 2,100 in men. Here with us to talk about breast cancer and what to know about getting diagnosed is Dr. Elizabeth Prier. Doctor, thank you for being here. You're with St. Alphonsus. What is it exactly that you do on a day-to-day basis?
Sure. So I'm a breast cancer surgeon, specifically called a breast surgical oncologist. I help take care of women when they're recently diagnosed with breast cancer and do the surgery for breast cancer treatment. I also help run our breast cancer program at St. Alphonsus in coordination with our radiologists. Before
people ever see you, there's that preventative step. So why should people get screened, and why is prevention so key?
Yeah, so breast cancer is the second most common diagnosed cancer in women in the United States. So 1 in 8 women will get diagnosed with breast cancer. So because of how common it is, catching a breast cancer when it's small and early stage can really help improve success rate in treating it, and also obviously lead to a lot less treatments if we can catch something when it's small.
And you mentioned women, but men get breast cancer as well.
That's right. Men get breast cancer, certainly not as common, but we do see men with breast cancer. It can be a little more common in men when they have a family history of it, but I certainly take care of men who don't have any family history, so being aware if you notice changes, a lump, certainly it's a common sign of breast cancer in men when they feel a lump.
It's difficult because they're often not having those conversations with their primary care providers like women are, right?
Absolutely. No, I mean, I've had conversations where the couple where the wife's like, wow, we never thought he'd be the one that we came in to talk about breast cancer with.
So tell me, in terms of screening, how can people themselves, before they get to that point where they come into their doctor, how can people themselves catch it? What are some of the signs?
Yeah, so common signs, the most common sign of breast cancer, if you have symptoms, is a palpable lump. So people come in, feel a lump. Breast cancer is actually usually not painful, so most women that have breast cancer don't actually have pain. So it's usually a lump that's not painful. I do see women, unfortunately, come in where the cancer may be a little more advanced. They've got some skin changes, so I often tell people, look for skin changes, look in the mirror, make sure the breast looks symmetric. If you notice one side looks a little different or is pulled in, or dimpling of the skin, that's another common sign. As the tumor grows, it can kind of pull things in towards it.
Did the age for mammograms lower too in recent years?
It's a bit of a debatable topic, but it's stated about 40 with most standard guidelines. So St. Alphonsus, we recommend starting screening mammograms at 40, not usually before 40, but there's been some debate. You start at 40, 45, or 50. We recommend starting at 40.
Okay, and what should you do if you think that you might have breast cancer?
Yeah, so if you think you have breast cancer, go to your doctor, get checked out. If you don't have a doctor or can't get into them, I encourage you to go to an urgent care, get checked out. One thing I would say that people sometimes don't get in for getting checked out is because they're worried, well, I don't have insurance. And there's a lot of grant money that's out there. All the breast care centers at St. Luke's, St. Al's have grant money to cover a mammogram. There's lots of ways we can cover a workup for you. So don't not come in just because you're worried about not having insurance. But call a breast care center, try to get a mammogram, call your doctor, go to an urgent care for a workup, and that can help get the ball rolling to get those things sorted out.
Okay. Thank you for saying that, and thank you so much for joining us. October, again, Breast Cancer Awareness Month. Dr. Prier, we appreciate you.
Yeah, absolutely. Thank you.
Yes, we're back with more of the news at 4 after this.